Hi, I'm Amanda Wojtusz, Team Lead and Co-Chair for the Joint Health and Safety at the Detroit Hamtramck Assembly Plant. Today we are going to speak with management about ergonomics. We are going to interview Patrick McCarthy, who is a facilities manager here at our site. Patrick, can you tell me what is ergonomics?
Well, ergonomics is basically understanding muscle injuries. Most common practice that we have for injuries is back pain. So a lot of times when we're working and we're mopping, sweeping, picking up stuff, we experience back pains, whether it's high or low. Sometimes we'll have pains in our hands and our arms. These are muscle injuries. This is what ergonomics is.
Okay, and what are the key factors?
I'm glad you asked. Well, up here on the board, we have what's called the hit list. These are ergonomic find-it risk factors. The first one being elbows out. Elbows out is typically when you're trying to lift up some type of material and it's a little bit too wide for your normal pickup. So you have your hands out here. Well, as you can see, my elbows are immediately out. When your elbows are out, you lose any strength in this arm, which means that now you're trying to really rely on other muscles to help you lift that load. That's basically what elbows out is. It's a strain of your arm and your elbow. The next one is shoulder too high. Shoulder too high is basically now we're looking at some type of material that's up on a high shelf. Maybe it's above the 72 inches that we regulate for custodial closets. When you're lifting up high, now you've lost a lot of your power. So now you're lifting from your arms and your shoulders. That puts a lot of burden on there. Again, you get strains and sprains. Next one is butts up. Instead of lifting high, now you're lifting too low. This typically happens when we put things directly on the floor. When we lift too low, now we're putting all the burden on our lower back. Thus, again, one of our highest injuries is back injuries. So, too high, too low, you're putting a burden on either your upper back, arms, or your lower back and arms and shoulders. Next one we have is twist and shout. A lot of times we see this when we mop the floors in our restrooms. What we're doing here is we're mopping and we've got like stall area where we can't fit in all the way, so we'll reach, and now we're twisting with our arms, trying to mop up something, we're twisting with our back. That causes sprains and strains as well. Next one is horizontal distance. Generally speaking on this one, it's when you're picking something up and you're going a long distance. Whether it's I picked something off my cart and now I gotta load it into my closet, or I'm taking something from my closet and I have to load it into a restroom or something. Horizontal distance is the distance you have to horizontally carry something for a long time. The longer you carry something, the heavier it gets, the harder it becomes. The more likely you are to not lift properly, and then you get sprains and strains. Last one is contact. Contact is when we direct contact to some type of hard metal or wood or even a wall. Now, the way we do this is generally if we're having to clean, we're leaning against something, or we're having to take stock that's far away, and we're having to reach across a metal shelf. The problem with that is sometimes that hard substance can push against our nerves. That's when you feel tingling in your arms, maybe loss of feeling in your fingers. So those are your find-it-risk factors.
Okay, and how do we protect ourselves?
Well, the best way for us to protect ourselves is three phases. First phase is to assess. Assess the areas that you're at. Make sure that you know what risks are there. Next is to correct. Correct those areas. Last thing, the most important thing is to communicate.
Okay, assess and correction. How do we perform these activities?
Good question. Right up here, we have two different forms. The first form is what we call a site assessment form. This allows management to partake in the assessment of the overall site. How many risks or how dangerous is it to the ergonomic factors? We look at things like our stock stored too high, stock stored too low. Do we have things in handshake height? Handshake height is what we call your normal lifting height, and that's where things are easiest to lift. Other things we look at is floor being wet. We look at the organization of your closet. Are you going to trip over something? Are you going to run into something because it's placed in the way? The other assessment we have is what we call the level 5 assessment. That's where you guys take place, and when you are going to a new job that you're not familiar with, where maybe we don't have a TIS for, you fill out an ergonomic assessment. It should kind of go hand in hand with your pretest. And then what you're doing is you're saying, all right, this is a new area I'm not familiar with. I'm going to check all these find it, hit it areas and make sure that we've got them all covered, that we're not at risk. And if we are at risk, we're going to correct them. So the corrective actions you get from both forms are then put into either your level 5 or 4 PPD board. They're sometimes put into a project or a problem-solving document. And then after they're fixed and we correct it, now we have to communicate it. Because the most important thing here is if we find a way to fix something, if you don't know about it, it's of no use. So that's how we do it.
Okay, and is there anything else?
Absolutely, but this is going to require for you to stand up. The last part is what we call stretching, and everyone's familiar with stretching. Whether you were in gym class or if you were in a team, you always had stretches usually before, but also after. So what we encourage you to do is to stretch in the morning, at lunch, and before you leave. Now when we stretch, what we're doing is basically we're warming up our muscles, right? You start off the day, your muscles are contracted. They're cold, if you will. And you have to warm them up a little bit, just like if you have an old car, warming up that engine before you start it up. So the first thing we're gonna do is forearm and wrist. So put your hand out like you're saying stop. Your other hand's gonna go against your fingers and push back. The whole important thing about stretching is that you don't hurt yourself. So don't jam your hand back like you're trying to break your wrist. Just lightly push against. It's all about light resistance. After you do that, you put your hand down. Again, you use your hand and push against. Now this is stretching out your wrist. The next thing you're going to want to do is your neck. So put your neck forward, your head forward, put your hand on the back of your head, and as you're pushing down, you're pushing up with your hand. You're pushing up with your head. Then you can also do it the other way, where you put your hand on top of your head, and then you hold down with your head and push up with your hand. Next thing is neck left and right. So same premise, you're just pushing against as you push up with your head. It's all about resistance. Next thing you want to do is elbow pull over. Take your elbow, you put it over, you touch your shoulder, you grab your hand, and that's all you're doing right here, right? You're just lifting up. Now you don't want to lift too high, because again, you're stretching out right here. Lifting too high, you might pull something. Just, again, light discomfort. Anything that becomes a really heavy discomfort, you want to stop. And then you just do it to the other side. Even just doing this, you can feel it, and you're just aiding that arm up. Next thing you want to talk about is the shoulder. So you take your shoulder, put your arm across your chest, take your other hand and just push against your elbow. You're pushing it. Same thing for the other side. And then you can do stretches for your ankles, you can do stretches for your legs. You can do stretches where you bend down and stuff. I don't advise that all the time because that's where most people do get injured. If you want to stretch, you get someone to secure a chair. You can then put your leg on the chair and then lean back a little bit. And that's going to stretch out your thighs. And that's it.
Okay, well thank you for your time.
You're welcome.
Thank you for watching, and we'll see you next month.
Was the hair up?